Hi, I'm Dr. Victoria Aimé. I'm a plastic surgeon in Scottsdale, Arizona. Today I want to chat with you a little bit about what a T-junction is in relationship to a breast lift. So when we do a breast lift surgery, oftentimes we need to move the nipple up. Usually the breast is a little too wide and a little too long. So typically what we'll do is move that nipple up by making an incision around the nipple and areola complex, and then a vertical incision along the midpoint of the breast, and then one along the lower portion of the breast too. So a T-junction is really where the incisions at the areola and the incision along the bottom or the inframammary crease meet that vertical incision. It forms a T at the top and it forms a T at the bottom. That T-junction is something that can break down when you're healing in recovery. This is what I mean by making the incision around the areola so that we can lift it higher up on the breast. If the breast is too wide, we're going to take out some of this breast tissue with this vertical incision, bring the breast together. And then if the breast is too long, which it often is, we're going to take out some of this lower portion of the breast as well and tighten that up as well. So we wind up with an incision or a scar around the areola, up and down the meridian of the breast, and along the inframammary crease. And where that lower incision meets the vertical incision here, and where the areolar incision meets this vertical incision, that's what we call the T-junction. When this happens, oftentimes I'll tell patients, let's just do some local wound care. It just requires putting on a little bit of Vaseline and a small dressing that we change until it heals in. Sometimes we do put a couple of extra sutures in if we need to, and very rarely do we need to revise it, but most often these T-junction breakdowns, when they occur, they heal pretty well on their own. To learn more about breast surgery or breast lift options, feel free to follow along or check out our website.